The Fertilizer and Soil Health in Africa conference, which is a policy and research conference, is very important for the conversations that will be taking place in the Africa Fertilizer and Soil Health Summit, which is held by the AU. It's important because we do believe that our policymakers, the governments and the different officials that are coming for that conference need to be armed with good quality information, which is evidence-based, but is also the product of good analysis. What we have tried to do with this conference is to assemble an array of researchers from the economics field, but also researchers from the agronomic sciences as well, where we are trying to combine the efforts of these two groups to answer important questions about how are we going to move the soil health and fertilizer use agenda on the African continent, especially for our generation, because what we are seeing is very low fertilizer uptake, and what we are seeing is that the health and the condition of African soils is such that in the next 10, 20 years, we could have massive famine because we are not ready. So what can we be doing now to make sure that Africa is ready in 20 years' time?
What you can also see here is that despite the subsidies, there are still years when Malawi produced under the national requirement. And mind you, these are all official numbers, which are probably slightly overestimated. The reality is a bit lower.
And it's believed that modern agricultural practices, such as the use of inorganic fertilizer, commercialization, or the use of all other modern agricultural practices are important for agricultural productivity growth.
Why do we need to know about the soil fertility? Basically, soil fertility provides the foundation for the nutritious food that we are just having.
We are living about a 50% of yield gap. And this low productivity is linked to poor soil fertility and low fertilizer.
The message to the stakeholders here is that soil health is really critical here in Africa, and combining different disciplines and points of view is important. Fertilizer and the economics of fertilizer and the politics around is one thing, but then addressing soil health, which is a longer-term issue, is another thing. And quite often we talk about the one thing, fertilizer policy or soil health, but we rarely talk about this together.
After 16 years, the increase in yield of the treatment with biochar and fertilizer combined was 1.2 ton grain, maize grain.
So you're looking at these kinds of dynamics and you're telling us to throw 50 kilograms of nitrogen into the soil. You're starting with a huge deficit. So I think we just need to be asking different questions.
We're worried about women's access to fertilizers. Perhaps that's why insurance doesn't increase demand for fertilizers.
Increasing soil organic matter improves the chemical, physical, and biological properties of a soil. So I think
the reason why it's important to have this discussion now is because these issues have recently come back onto the policy and donor agendas. I see this as the first part of a longer conversation about bringing together the research side of things and the policymaking side of things. This particular conversation is really oriented around having something to say to guide policy action in ways that's not pie in the sky, but is very tangible and practical and useful for policymakers who need to make some difficult decisions, but decisions that are very important to outcomes that we care about.